When we're playing, the boys say the girls have to be nurses. But I want to be a doctor.
The barium enema shows what looks to be a growth in the large bowel. Mr. Betancourt intends to remove this growth in theatre tomorrow. Because you're a diabetic, I'll assure you you're booked first on the list, and I've written you up for a drip that will give you sugar and insulin. So, any questions?
Yes, nurse. Where's the doctor going to see me?
Dr. Broom. Thank you. The hemicolectomy sorted for tomorrow. Could you see the other TCI, please, while I chase up Mr. Orton's x-rays? I'm already late for theatre.
I'm a coiled spring.
What's she so miserable about?
Primary coming up.
Doctor, Mr. Orton's temperature's up again.
Then don't measure it. If we don't know his temperature, we shan't have a fever to worry about. Who's the slapper?
Oh, that's the legendary Nurse Whitecoat, just transferred from geriatrics.
Why do they call a white coat?
Dr. Broom.
Morning, Mr. Betancourt.
There are admissions not clerked, test results gone astray, patients inadequately prepared for theatre. You cannot expect your houseman to do all the work himself. Pull your socks up, Monica, or I'll KY them to your kneecaps. And I want this ward kept quiet from new admissions for the next couple of weeks so that I can get my waiting list patients in and the management off my back. Monica! Theatre!
He's like a father to me. My father's a bastard too.
Keep the ward quiet. What are we supposed to do? Tell people to stop getting ill?
If Betancourt wants quiet, he should try Mengley Ward. They've got an outbreak of MRSA.
Hello, my love. Sorry to disturb you.
You're here for my leg, aren't you?
Yes, just need to take some more samples.
They've told me that all this to do is because of this dangerous germ I've got in my leg.
Just a few more swabs for some tests.
For heaven's sake, Peter, I'm at work. They are your kids, too.
You're right, I'm sorry. Listen, Julian has invited us for dinner on Friday night.
I'm on take Friday.
Any chance of swapping?
I'll do my best, but I doubt I'll be able to.
Terry's wife always seems to manage.
Terry's wife is a nurse.
Maybe I should have married a nurse instead of a doctor.
Where the hell's that dobutamine I asked for 10 minutes ago?
Claire, it's Dr. Turner. Phone back on the ward, please.
You go on the ward round, I'll stay on here till this chat's a bit more stable.
Okay. Thanks for your help.
Dr. Maitland, this is your mess too, you know.
You should be in bed with a hot water bottle.
Mrs. Carmichael's monitor from this morning.
I'm sure you have this effect on all our female patients, Charge Nurse Scrivens.
Dr. Maitland, we're having terrible trouble with Mrs. Khan over at IM chlorpromazine.
Then you have my permission to use your initiative.
None of us are happy to give the injection, so you'll have to do it.
I'm not happy either to do something that you do every day and I've never done.
That's a fine attitude.
Nursing problems are for nurses. I'm not going to stick a needle in someone's arse just because you want to dump your work on a doctor.
Did you catch much sleep yourself?
None.
The life of a house dog, eh? In my day, we were house dogs. I can remember having to caddy for the prof at weekends and dance with his wife at the hospital ball, so I know what it's like. Listen to the nurses. They'll help you hugely if you treat them well. And if you do have any worries, rest assured my door is always open.
Thank you, Dr. Tan.
Okay.
Peter, I have tried. All right then, dear. I'll see you tonight. Bye.
Microbiology just found. We have 3 cases of MRSA on the ward.
Right.
Hi.
But Andrew, you couldn't rewrite these drug charts for me, could you? Having them spread over more than one sheet. So untidy, don't you agree?
Yeah, I'd like to get a coffee first, sister. I'll be 10 minutes.
Sister, can I have the drug key? I would have thought you would have had the day off with being up all night. Sister, I think it's gone time for me and Sally to go for break.
Off you go, love. Could you just stay and do those charts, please? Look, Andrew, there'll be plenty of time for coffee later. Oh, also, you don't mind doing the IV drugs for me this morning, do you?
Sister, I thought that the nurses did the IVs.
Yeah, I would do, only I'm on the bleed for the whole hospital. Andrew, I was doing this while you were still filling your nappy. Just remember that.
Yes, of course. Sorry, sister, you're right.
You're doing an exam soon, aren't you?
Primary FRCS.
Must be hard work studying and working as well, eh?
Oh, it's not that bad. All I've done for 3 months is work, study and sleep. I can't help thinking that when I die, the maggots that eat my corpse won't show it any more respect if I was a fellow of the Royal College of Surgeons than if I wasn't.
Mr. Betancourt's on the phone screaming blue murder about a missing cross match.
Thank you.
Hello.
Hello, I'm Dr. Turner's houseman.
Karen Taylor, Kai's sister. Right, an old patient of Dr. Turner's, 55-year-old man, brought in collapsed. His GP note.
Collapse. BP 150/90. Query CVA. Please see and do the needful. I'm busy in casualty. I'll be with you when I can.
Could you leave us alone just for a few moments, please, Mrs. Burrows? His name is Ted Burrows.
Hello, Ted. I'm Dr. Colin. We're going to take a little look at you.
His BP is 260/140, pulse 50. According to his wife, it started with a headache, then vomiting. His conscious level has progressively deteriorated all day.
Thanks.
He'll need an urgent CT scan. That has to be ordered by an SHO or above. So you've got your excuse for calling Claire.
Thanks.
How is he? Please, doctor.
It's a little early to tell. I need to organise some tests and then we'll know more. Sister, I don't mean to sound rude, but you bleeped me about this a minute ago. I'll be there when I can.
It isn't serious, is it, doctor?
Claire?
Andrew, pass a big Venflon and take blood for urgent FBC, U&E, LFTs, glucose clotting and calcium profile. Karen, could you set up
20% mannitol? On its way.
100 grams over 10 minutes. If this is a CVA, I'm Hilary Jones.